Hello everyone, welcome to another episode of CoinNewsExtra interview session. So today we'll be talking about digital innovation in healthcare. So we have a personality and an expert in this sector who will be helping us to talk about this. We have in the person of Ingrid Feltes. She is a healthcare executive. Ingrid, you're welcome to CoinNewsExtra.
Thank you for having me. It's a pleasure to be invited on yours.
It's a pleasure to have you to talk about this on our show. So we'll be talking about the digital innovation in the healthcare. You being an expert, you have experience in this in the healthcare sector. You will be able to know how digital innovations can play a vital role in the healthcare. So, but before we move to that topic, we want to know a brief about you. Just tell us a brief about you.
Sure. I wear multiple hats, so to speak. I have multiple roles. My main role is to be a quality and innovation officer in a healthcare company, but I also consider myself a globalist, futurist, and digital advocate. So therefore, you're gonna have me usually advocate for digital technology adoption. I care a lot about digital ethics. I volunteer for several international organizations such as Women in AI, Inspired Minds, that all are focusing on developing and adopting modern technologies and applying them in various sectors. I also volunteer for blockchain in healthcare today, where we're trying to promote adoption of blockchain technologies as well as telemedicine in healthcare today. So that gives you a 360 view of most of my activities.
Interesting. You have a very nice background when it comes to this sector. So we are trying to understand digital innovation in healthcare. But before that, what's digital innovation? When we talk about digital innovation, we want to know what it is.
That's a great start. I always say it's important to know how we define it. So the official definition says that it is the application of technologies in the way we interact with our society, and that includes products, processes, and sometimes even introducing new concepts. However, I like to always quote some famous genius inventors that I think made it very simple. And one that I like in particular is true innovation is something that we never even imagined before. And I think most of the innovative technologies that we deal with now, if you asked us a few years ago to even describe them, we could have never imagined them. So that's the one I like best. It's something that our mind can't even imagine, and then it comes through technology.
Interesting. So you've been in the healthcare sector and you see what is happening. Most even in this COVID, we've seen how technologies, innovations are making a part. So how do you think healthcare sector can leverage digital innovation?
I think actually digital innovation can be most helpful for the healthcare sector, although it was always lagging behind. I think at this point, it's the health sector that can benefit the most. And I would structure it in 5 domains. One is patient care, just as a very large domain. Then another one is management of care, and I will explain what that means. And then research, of course, research and development to invent new medications, new treatment methodologies, new devices, new ways to even define disease. And then the other very big category are what I call our portfolio of tools, such as medical devices, medical supplies, diagnostic methodologies, and imaging methodologies. So I do truly feel that through these innovative technologies, we can affect the full 360 spectrum in healthcare.
Interesting. Talking about digital innovation, what are some of the ways emerging techs like blockchain, AI, and can be of importance to the health sector? We see what these emerging techs are doing, what AI is doing, and what blockchain is doing, transforming some other sectors. How can it be of importance to the healthcare sector?
Sure. I would like to answer this a little bit broader. So, on the one level, I believe blockchain can be the foundation for several new ways we even define health and the way we define disease. It can be a gateway to wellness, longevity, managing disease. I also believe that it can be the catalyst for developing novel types of medications and novel types of way of delivering care. And specifically, blockchain has been deployed in at least 10 types of use cases, such as how we document electronic records and make them available to patients, how we do provider credentialing, in the research and development of new drugs, in the development of new vaccines. It has been also now in the pandemic deployed in managing supplies such as masks and ventilators and many other necessary supplies for healthcare in general, as well as the specific medications that were in shortage around the world. It has also been deployed very successfully in organ donor tracking. There are companies that have used blockchain to help medication safety, to prevent errors and to prevent adverse reactions. So the list goes on and on and on. As you can see, blockchain can be the foundation for a lot of very successful solutions that address pain points in the healthcare industry. That's for blockchain. I do believe that there are several other emerging technologies that are equally important, though. So maybe we get a chance to talk about those as well.
Yes, yes, yes. We know what emerging techs are doing to different sectors. That leaves us, before we draw the curtain on today's edition of CoinNewsExtra interview session. So, what are the ways forward for the health sector when it comes to digital innovation? You see what the pandemic is doing. What do you see?
Well, I think there are three pathways that I think we have to approach as a society. One is we have to break the silos. And the way I like to always explain is if everybody comes together and shares the common knowledge, it would help us a lot as a society to improve global population health. As an example, if everybody would be able to share what is important in research and development for new vaccines, like we've seen lately, right? Major pharma companies have tried to join forces to expedite the process. So I think that's one, breaking silos and having more collaboration globally that would help us to not waste precious time and try to figure out the same things that someone else has already found out. The second one is, I do believe that focusing on precision medicine, which is a novel concept over the past few years that has emerged, that is based on genomics. So by using genomics as well as augmented intelligence, nanotechnology, we can develop a much better way to prevent disease and manage disease, and that's called precision medicine. So by using the genetic predispositions and much more advanced nanotechnology tools, as well as augmented intelligence portfolio tools, we can actually have a completely different way of practicing medicine that is much more customized to each unique individual's genetic makeup, and then also have what we call personalized medicine, where each unique individual can define the value of healthcare to them and what is important to them. Some individuals care more about wellness. They don't even want to get sick. Others care more about appropriate management of disease. And then yet others even consider aging a disease and want to focus on longevity. So I think moving forward, I would say there are three big concepts to summarize them. One is a global healthcare system approach where the good of society comes first. The second is focusing on precision medicine and personalized medicine solutions where the unique individual needs are priority. And then last but not least, what we mentioned in terms of a global exchange of common knowledge, specifically for research and development for new disease diagnosis, new medication development, and specifically, like we've seen, epidemiology, meaning developing vaccines that can not only help COVID, but more importantly, prevent future pandemics, because COVID is just one of them, but we can have a new virus emerge tomorrow. So I think the broader challenge for us in the scientific and medical and business community is to develop a better mechanism of approaching any type of new disease or any type of new pandemic that's gonna emerge. So those are my views.
Thank you very much. You've heard it from her when it comes to digital innovation in healthcare, how the digital innovation can play a vital role in the healthcare sector. Thank you very much, Ingrid Vasiliu-Feltes, for joining us today on CoinNewsExtra interview.
Thank you. It was a pleasure to be here.
It's our pleasure to have you also. Thank you very much.